Good evening, everyone. This is Meldita, and I'm back at my YouTube channel, MELDITA'S Info Corner. Okay, so management of ventricular tachycardia with pulse. The patient is conscious, and there are two kinds here. Asymptomatic ventricular tachycardia with pulse, which is tolerated, and there is this symptomatic, which is not tolerated, which I will be discussing soon. So my focus right now will be asymptomatic ventricular tachycardia with pulse. So here we go. We have a patient, and we notice this wide complex tachycardia here, okay? And the patient is conscious, okay? He's talking. There's palpitation. The patient will complain about that. The heart rate is fast, more than 100 beats per minute. It's a wide complex ventricular tachycardia. The blood pressure may drop slightly, but there's no short of breath. There's no chest pain. Okay, so because it's a teamwork in the CCU or coronary care unit, this is what we're gonna do upon discovering this wide complex tachycardia, which we are sure this is beta. So we continuously monitor the patient and the assessment. We do start ECG 12 leads. That is a protocol. And we start on IV fluids, usually normal saline. We have policies to follow and protocol to follow. And we create another IV saline lot, just in case. Crash cart will be at the bedside. We will connect the patient to defib pads and to the monitor. We will check the last blood works. We check the potassium, magnesium, and other abnormalities there if there are. And we will communicate with the cardiologist. So all these things will happen very quickly. And then he will surely be ordering replacement of borderline low electrolytes, magnesium, IV, and potassium. We will be giving this, okay? And then the amiodarone will surely be the drug of choice, which is good for narrow complex and wide complex ventricular tachycardia. And he will be updated all the time for the progress, because this is wide complex tachycardia until it converts. Okay, so there are two kinds of action potential in here. There is an action potential of Purkinje cell. There is an action potential of pacemaker cell. The action potential of Purkinje cell, just like atrial and ventricular, they have all the same resting membrane potential, which is minus 90. Okay, there are 5 phases of action potential in here, from 0, 1, 2, 3, and 4. And that is the QRST if we're talking about the ECG correlation. So here is the picture of an action potential of a Purkinje cell. So we have here 0. That is the sodium entry. This is the depolarization. Okay, 0 or phase 4 is 0 depolarization. And that is the QRS. There we go. So that's the QRS, the blue one. Next, you see that the start of repolarization is from 1 to 3. So you notice that this one descends a little bit. That is the outward flow of potassium briefly. And then the sodium is inactive, followed by calcium. There's no electricity involved in here. So this is mechanical. The heart is pumping here. There's a contraction, and that is the ST segment. And on the phase 3, which is the last portion of repolarization, is the large amount of potassium efflux or outward flow of potassium. And then that is actually the T wave. And then here it goes back again to phase 4 with a resting membrane potential of minus 90. So let's make it simpler. So we have 0 as the depolarization. We have 1 to 3 as our repolarization. And we have 4 as our polarization, meaning the cell will be activated anytime by a stimulus again. Okay? So repolarization, that is your QRS, okay, stimulating the muscle electrically. And then we have the repolarization, okay, and go back again to their usual sites. So the sodium pump potassium will bring in all the potassium outside back in, and the sodium all out, okay? So that's it. So this is the Purkinje cell action potential. So how about the pacemaker cell action potential? It's different. Usually we have SA node or the AV node here. So here, these are the phases of the pacemaker cell action potential. So 4. If you notice the 4, there is a gradual depolarization. It's already upward. So that's a gradual depolarization. Okay, and then the real depolarization of the pacemaker cell is actually 0 which is actually the calcium as the player here. From the slow channel, the calcium here gets in, okay? Unlike the one in Purkinje cell, action potential, it's steep. You notice this one, zero depolarization, it's steep. Right away, fast sodium channel, sodium ions get in. Here is slow. So this is calcium, this is the calcium channel, which is slow, and the calcium getting in. And down here we have the 3. This is the phase 3, which is the repolarization, and back to the usual resting membrane potential area here, which is 4, and that is minus 70. Okay, so I discussed this first so that before we proceed to the antiarrhythmic medications here. And again, this will follow. So don't forget, this is my YouTube channel, MELDITA'S Info Corner. So if you think it's okay, you are free or welcome to press like, share, and subscribe. Okay, and then antiarrhythmic medications will be next to discuss. Thank you so much.